Good afternoon. My name is Gaston Herndon, and this is my LUT1 presentation for Western Governors University. Today I'm going to be talking to you about hepatic failure caused by alcohol and drugs. According to the American Liver Foundation, more than 15 million people in the United States suffer from liver and gallbladder disease, and more than 43,000 die of liver disease each year. Cirrhosis of the liver is a chronic degenerative disease in which normal liver cells are damaged and are then replaced by scar tissue, according to Ignorance and Workman 2006. If this condition is left untreated, it can lead to hepatic failure, which is life-threatening and is associated with high mortality rate that can reach as much as 80%, according to Urban 2008. According to the National Institute of Diabetes and Digestive and Kidney Disease, the NIDDK, it is the seventh leading cause of death in the United States. Research suggests that in the United States, the most common cause of liver disease and hepatic liver failure is alcohol and recreational drugs, and may be prevented and thereby treated successfully by patient education and attending groups such as Alcoholics Anonymous and Narcotics Anonymous. Patient education on the effects of alcohol and recreational drugs are effective in preventing and helping to reverse liver disease and hepatic failure due to alcohol and drugs. Attending groups such as Alcoholics Anonymous and Narcotics Anonymous can help patients prevent and sometimes reverse liver disease and hepatic failure. If you look at the chart behind me, excessive alcohol use is estimated at 79,000 if you combine all the different alcohol diseases which are related. Approximately 36,000 deaths annually result from chronic alcohol-related illness rather than acute causes such as motor vehicle crashes and falls. As you can see, liver disease caused by alcohol is more than 3 times any other alcohol-related disease, which can result in death. Patient education must be provided to a client with hepatic failure to help them understand how their consumption of alcohol and/or recreational drugs are contributing to their disease, according to Warman 2006. First, avoid consuming alcohol and any medications not prescribed by a physician. If help is needed with addiction to a substance, seek help from a professional. Alcohol consumption has been associated with alcoholic hepatitis, fatty infiltration of the liver, accelerated progression of liver disease, and a higher frequency of other cirrhoses. The daily consumption of more than 4 drinks, or 43 grams, of alcohol increases the risk of cirrhosis as well as death from other causes, according to Thun 1997. Hepatitis C is also a disease common among ingested drug users. Research studies have found very high infection rates among drug users, and those that are infected are at risk for inflammation and failure of the liver, according to Whiteman and McCormick 2006. Attending Alcoholics Anonymous or Narcotics Anonymous can help patients prevent or even reverse liver disease and cirrhosis. Abstinence from alcohol is vital to prevent further liver injury, scarring, and possibly liver failure. Belonging to a support group such as Alcoholics Anonymous or Narcotics Anonymous can help the patient remain alcohol or drug-free, according to Thun 1997. Without belonging to some type of support group, the patient is more likely to digress into their prior behavior of drinking or use of drugs, according to Whitman and McCormick 2005. In conclusion, research suggests that in the United States, the most common cause of liver disease and hepatic liver failure is alcohol and recreational drugs, and may be prevented and treated successfully by patient education and attending groups such as Alcoholics Anonymous or Narcotics Anonymous. Patient education on the effects of alcohol and recreational drugs are used effectively in preventing liver disease and cirrhosis. Attending groups such as Alcoholics Anonymous or Narcotics Anonymous can help patients prevent liver disease and cirrhosis. By educating the patient on how the consumption of alcohol and/or recreational drugs is detrimental to their health, the patient is more likely to adhere to staying away from alcohol and drugs, thus decreasing their chances of liver disease. By attending a support group such as Alcoholics Anonymous or Narcotics Anonymous, the patient is less likely to regress back into their prior lifestyle. So what does all this mean to the patient who is diagnosed with hepatic liver failure due to alcohol or drugs? A life-saving opportunity. We can say to them that that they stand a good chance of dying if they do not change their ways. We can tell them that if they stop alcohol or drug use, that there is a very good chance that the damage to the liver will not only stop, but very well be reversed. And we can offer them the support system of Alcoholics Anonymous or Narcotics Anonymous to help them remain alcohol and or drug free. Are there any questions?
Is hepatic liver disease that's caused by alcohol reversible if the patient stops drinking?
Yes, some types of liver disease, such as fatty liver, is usually reversible if recognized and treated. There may be some long-term tendency toward other types of liver problems, depending on how long or how severe the fatty liver condition was. Any other questions?
Can prescription drugs cause liver disease and failure also?
Yes. Drug-induced liver diseases are diseases of the liver that are caused by physician-prescribed medications or over-the-counter medications. It can also be caused by vitamins or hormones. Any prescription drug or non-prescription drug can affect the liver. Any other questions?
Once a person has contracted hepatitis C, is it possible to ever get rid of it?
The chance of curing hepatitis C is part on the type of hepatitis C that the person has, the genotype. The chance is approximately 70 to 80% for people with genotype 1 and 80% or more for people with genotypes 2 and 3. The determination of if a patient is cured cannot be made till after about 6 months of treatment is completed. The cure is defined as having no detectable levels of the virus for more than 6 months after stopping treatment. Follow-up studies of these people have shown no trace of the virus in the blood for over 10 years. I thank you for attending my presentation, and I look forward to speaking with you in the future.